The third session on urban life examines how epidemic illnesses exploited and amplified social divisions and how epidemic interventions were leveraged against, experienced, and navigated by different communities. Here we explored the impact of pandemics on social practices more generally and on inequality, racial and ethnic tensions, and displacement more specifically, and indeed more importantly. Our discussant today is Sandro Galea.
Dr. Galea is a physician, epidemiologist, and author, and the dean and professor at Boston University School of Public Health. Dr. Galea holds a medical degree from the University of Toronto, graduate degrees from Harvard University and Columbia University, and an honorary doctorate from the University of Glasgow. He previously held academic and leadership positions at Columbia University, the University of Michigan, and the New York Academy of Medicine. Dr. Galea has published extensively in the peer-reviewed literature and is a regular contributor to a range of public media about the social causes of health, mental health, and the consequences of trauma. He has been listed as one of the most widely cited scholars in the social sciences. He is the chair of the board of the Association of Schools and Programs of Public Health and past president of the Society for Epidemiologic Research and the Interdisciplinary Association for Population Health Science. As an elected member of the National Academy of Medicine, Dr. Galea has received several Lifetime Achievement Awards.
Well, thank you very much. Thank you, Dr. DeClercq and Dr. Gadripur. Thank you for having me. And thank you everybody who is both listening as well as those who participated in the Urban Life session. So as you heard in the introduction, I have long been interested in, broadly speaking, how the world around us produces health. And cities are a big part of the world around us. I have coincidentally also had a long-standing interest in traumas and how traumas, both at the individual level and large-scale traumas, affect our health. So I've studied, for example, the consequences of the 9/11 attacks on New York City and Hurricane Katrina in New Orleans, and events like that. And right now we're in the middle of this COVID moment, which of course has been a moment that has really affected cities. Principally right now has been the East Coast, although now spreading in cities around the country, bringing up a lot of interesting questions and points about urban living and how it intersects with pandemics and with circumstances like the ones we're living through. I thought the presentation in the Urban Life session were terrific, and they make some fundamental points. At some core level, they make the point that pandemics are as old as time. They also make the point that pandemics, and so far as they're as old as time, have always been a concern of cities, that cities represent the perfect intersection of place with risk of pandemics. And I learned from watching these presentations, but I thought they illustrated some points that really are universal, that they well transcend the archaeologic era that some of the presentations talk to. So I thought I would frame my comments around 4 points. Number one, I want to talk about what are pandemics and why pandemics. And number two, what about cities? What are cities and why should we think of cities in the context of pandemics and trauma? Number three is what do we learn from history? And number four, perhaps most importantly, what do we learn for the future from these examples? So let me start with number one. Let's start with pandemics. So pandemics fundamentally are about transmission of infectious disease, usually a novel pathogen, which the human organism is not immune to. The human organism can be immune through prior infection or else through vaccine. Obviously, in the course of history, this has been more common than it is now because there was no vaccination. Now, I say things that I suspect everybody who's listening to this knows, but I say it because a fundamental feature of pandemics is spread of infectious disease, and that spread of infectious disease usually requires people spreading it to one another. Now, I say that because such spread benefits always from people being tightly condensed. So having people close together facilitates spread of pandemics, which almost by definition then means that cities are conducive to the spread of pandemics. I think it's with that in mind that you really cannot separate the history of pandemics, the present of pandemics, and the future of pandemics from thinking about cities, because the criterion for pandemic spread is almost ineluctably linked to the very definition of cities. We see that when we think historically, and we see that when we think now. For example, in the COVID pandemic, New York City has been the epicenter of the COVID pandemic in the United States. There's many reasons for that, but perhaps one of the most obvious reasons is the dense population of residents of New York City. So I was delighted to see this seminar happening because it strikes me that cities as being pathognomonic for a place of high risk for pandemic has been missing from the public conversation. It's important to put in the public conversation. So point A, we really cannot think about pandemics without thinking about cities. Now point B, so let's talk about cities. So what are cities? Now, in some respects, I can imagine that the listener might say, well, that's a little bit obvious, that we know what cities are, but it's actually not so obvious and it's not so clear what a city is. There are in fact many definitions of cities. Different countries have different definitions of cities. We do know that they have some characteristics, that they are where there are more people within some confined space, more condensed together. Of course, a country like China, for example, has dozens of definitions for cities. A country like Canada has a definition for cities that's different than a country like the United States. But fundamentally, cities are where more and more people are. We crossed the 50% threshold with more than half the world's population living in cities quite a while ago now, more than a decade ago. And we are moving to a world where 2/3 of the world's population live in cities. So urban living has become the modal way of living. We as human beings are more likely to be living in cities than not. Now, understanding that point becomes important if you care about pandemics and the risk of pandemics, because if you understand the previous point I just made, that pandemics are facilitated by the existence of cities, and you realize that cities are becoming more and more modal, then we realize that we're sort of in trouble unless we wrap our brain around how cities intersect with pandemics. Because cities, places that are densely populated, that are becoming modal, are the place where pandemics are likely to spread. I do want to make one other point about cities before I move on from this point. While cities are places where we concentrate people, they also are places where we tend to concentrate people around water. If you look at the world, if you look at a map, at an aerial view of the world, and you'll see that cities are very close to water. That has meant that the number of disasters that cities are subject to, not just pandemics, not just infectious disease outbreaks, has increased dramatically in the past several decades. And the reason for that is because of global environmental climate change that has resulted in hydrological disasters. So more and more people living in these areas that are at greater risk for large traumas driven by where they are geographically. So number one, pandemics depend on cities, on person-to-person contact, and that person-to-person contact is more common in cities. Number two, more and more of us are living in cities, which puts us more and more at risk, actually, of pandemic spread as well as other disasters. Number three, so what do we learn from history? Well, I think there's a lot that we can learn from history, and in some respects, watching the preceding presentations, I was struck by the commonalities between things that happened hundreds and thousands of years ago and today. Cities have long had to deal with pandemics, and as a result, they've long tried to figure out how to grapple with outbreaks. There have always been stages of human interaction with these pandemics, starting from fear and panic, moving to rapid action, moving to implement a number of initiatives that some of which did not hold up later. For example, you heard about the use of DDT that might sort of have worked in some situations, but not in others. And then a readjustment, a realignment, an evolution of a city into a new normal. We also realize from historical examples that the weight of the consequences of the pandemic in cities almost always falls unevenly. The urban haves do better than do the urban have-nots. And in many cases, the gap between haves and have-nots widens when these pandemics happen. We heard about it historically, and we're seeing it happen today with COVID. I think the other thing we learn historically is that these cities are always trying to balance a risk of infection versus the risk of shutting down all urban life. It is a constant struggle. It has been a historical struggle as we're seeing it now with COVID. And the answer has never been throughout history one or the other, that completely shutting down urban life to protect us from the pandemic or allowing urban life to continue unfettered and ignoring the pandemic. But you heard it from the preceding presentations that there is this tug between how do we balance the risk of infection and the risks that come from shutting down completely urban life. So in some respects, the grappling with these outbreaks the stages of response to the outbreak, going from fear, panic to rapid action, implementing initiatives, then to readjusting those initiatives, and then emerging into a new normal. And all of that informed by a balance of risks, risk of infection, risk of shutting down urban life. All of that has been the case historically, and it has been exactly what's been happening now with COVID. So my fourth point, which perhaps is the most important point, which is, okay, understanding what pandemics are, understanding what cities are, understanding that the two play off each other, the two feed off each other. Cities make pandemics more likely. Pandemics are, by definition, threatening cities. And understanding that this is a tale as old as human time. The question is, what do these examples teach us for the future? What do they teach us in terms of thinking about the contagion next time? What do they teach us about how we may structure our life to mitigate the risk of future pandemics in future? So I think to answer that question, we need to take a step back and say, what are the key characteristics of cities? And what are the features of cities that ultimately drive the spread of pandemic? And I would argue that there are four key characteristics. There's obviously dozens and hundreds of characteristics, but just by way of taxonomy, I think there are four. And they are spaces, assets, stressors, and connections. So let me talk about each one of them. Number one, spaces. Cities ultimately are about spaces. They are about human-made spaces, which means they're spaces we can control. But they are spaces. They're the places we live, the places we exercise, the places we work. And these are the places that control our interpersonal connection. And those spaces, as a result, are the spaces that result in changing our risk for pandemic spread. So one can imagine designing spaces in such a way that they are more amenable to creating physical distance if we need to. Not creating physical distance at all times, but to have the capacity for physical distance if an infectious disease outbreak happens. One can imagine creating urban living spaces that are more conducive to people sheltering in place than urban living spaces that are not. One can imagine having parks that are designed in such a way as to allow the use of those parks even with some modicum of physical distancing is needed. So spaces ultimately are what determine whether cities are going to be generating, fueling pandemics or not. Number two, assets. People with assets can protect themselves from pandemics. People without assets, less so. Now, that is important to keep in mind, not simply from an idealistic perspective, but from a place that says a pandemic should teach us that if you're at risk, I'm at risk. If I'm at risk, you're at risk, which means there is a public good inherent in thinking about creating enough assets so that we can all be resilient to the threat of a pandemic. That is different than how we tend to think. We tend to think of health as something that we can buy and sell, but what we can buy is sick care, a way to treat us after we already have the pandemic. We should be thinking about health as a public good and making sure everybody has the assets to buy us that public good. And that requires an imagining of cities as being health-producing places, places where there is no housing gap, where everybody can afford housing, where there's wage fairness, where there's gender equity, and there's less violence. Now, in some respects, these assets are assets you might wish in any city, but they're also assets that represent our best line of protection against pandemics. So if anything, pandemics should sharpen our focus on creating cities with assets that can withstand its effects. Stressors. Stressors are the exogenous forces that fray at our collective sense of safety. They are traumas. They are the fear of the virus. They are unemployment that happens with the virus. They are the civil unrest that emerges from deep, long-held divides that color everything we do. So stressors are the counter of assets, and they are conditions within cities that we should do better than. And again, I come back to this point. These are always the case, but they should be even more the case when we recognize that we want to mitigate the course of pandemics. How do we create a system which can mitigate the effect of stressors on me and on you? And how do we recognize that doing so is not simply helping a few, but helping all of us because it mitigates the effect of the pandemic? And number four is connections. So spaces, assets, stressors, and connections. Cities are about connections. It is about us living in similar places. It's about us not being socially isolated. It's about a way of mitigating our potential poor mental health in the context of the circumstances of the moment. It is about creating connections between young and old, and it is about being able to titrate those connections as needed to mitigate the spread of pandemic. So spaces, assets, stressors, connection. If you think back about the other presentations in the panel, in the session that I'm referring to, you'll see that the historical examples were motivated by different design of spaces, by people who had assets, people who didn't have assets, by the stressors people faced that tipped them into not being able to cope with the consequences of the pandemics, and the connections that either fueled the pandemic or could be re-engineered to mitigate the spread of the pandemic. Now, I'll conclude with trends then. So in terms of what these examples teach us for the future, it seems to me to say, okay, we understand that. Let's say we understand what I just said. Let's say that we redouble our effort, and I hope we do right now, to build healthy cities, to build healthy spaces, ensure that we have ways to ensure basic assets for everybody, ways to mitigate stressors, and ways to create healthy connections. Let's say we do all of that. It seems to me appropriate to say, what are trends? What are trends in cities? Where are cities headed? Well, there are four major trends that I think are shaping the world. Those trends are: number one, urbanization. That's cities, we're talking about that. Number two, it's migration. Three, it's population aging. And four, it's climate change. So let's talk about each of them. We are migrating more and more. Migration is happening all over the world, with people flowing largely into cities. That is going to create heterogeneity into cities. It's going to create different populations in cities, and it's going to create the very visible signs of people coming to cities who are not accustomed to being in cities. And cities need to be able to cope with that. We need to be able to create ways of integrating people who are migrating into cities, number one. Number two, aging. We now have worldwide more people over age 65 than under the age of 5. That means that we are going to have a substantially different population in cities in 2050 than we have now. That presents challenges, but also opportunities. How does population aging intersect with spaces, assets, stressors, and connections? And number four is climate change. Global environmental climate change creates other risks. I mentioned earlier how it creates hydrological risks and creates risk for disasters in cities. It also creates differences for vector control and for different potential spread of disease. But it also creates heat and heat waves, which affect how we should be thinking about our spaces, our indoor spaces. It affects the extent to which we connect. So as we have more and more people living in cities, more urbanization, more migration into cities mostly, aging population, climate change creating new threats, these are the forces that are going to shape cities of the future. And I think we need to then think about urban spaces, assets, stressors, and connections, and how to shape those to prevent pandemics. Now, if we've learned something from the past, is that I said prevent pandemics is probably not entirely correct, because pandemics are going to happen. There will be a new novel pathogen. But there's about a novel pathogen that crosses from the animal world to the human world about once a year, that is of some consequence. So there will be other outbreaks. 2020 has been an extraordinary year with COVID because it has galvanized the world. But the one lesson we should take from this is that this will happen again. It will happen again. Cities will be more affected again. Cities will grapple with them, and we will have divides, social divides, which will map onto health divides. All of that will happen again, unless we think about where are cities headed in the future? What does a city with more migration, more aging, affected by climate change look like in the future? And how do we then think about our spaces, the assets within cities, the stressors people face, and our connections within cities? And to think about, for each of those, how we can set them up, how we can design them to create healthy cities that can protect their populations. Thank you for having me. Thank you for this conversation. Thank you for starting the conversation about cities and how cities intersect with pandemics, which I think this is a conversation that we need to be having more and more in coming days, coming weeks, coming months, coming years, and coming decades. Thank you, everybody.